According to the National Health Morbidity Survey, the prevalence of mental health issues among Malaysian adolescents has significantly increased in 2019 compared to 2015. With existing policies to tackle mental health, there's so much room for improvement, especially in terms of access to mental health interventions for relevant groups and sectors. To mark World Mental Health Day, we speak to Assistant Professor Dr. Muhammad Adil Zainal Abidin from IIUM on Malaysia's state of mental health and more.
Based on the National Health Mobility Survey among the adolescents, there's a very huge increment. We've got about 40% of our adolescents having a peer problem. In 2019, there's an increment of 10% from jumping from 30% in 2015, right? And we also have other problems such as conduct issue among the adolescents. The prevalence is 15%, and the prevalence of emotional problems is about 8%. And I think this is just the number, the prevalence, but I think what we need to know is the key risk factor behind this. And it's very striking that the problem is more among the B40 income bracket groups and among the rural areas. I think that's more alarming. In terms of policy at the national stage, we already have a good in place. And I think last year, in terms of the budget, for the 2023 budget, mental health alone received about 35 million in terms of the budget. So in terms of policy, in terms of the budget, is already good. And what more extraordinary is this year, what we have achieved in terms of mental health is that we have the parliament, particularly have unanimously passed a bill to decriminalize the suicide attempt by removing the section 309 of the penal code, which punishes the suicide attempter.
As Malaysia anticipates the tabling of Budget 2024 on Friday, Dr. Adil urged for more accessibility of funds for mental health across all relevant sectors.
Policy can go into the education, how we can educate, or perhaps we can incorporate in the education system, perhaps mental health education. Our neighbor, Singapore, have started 2 years ago incorporating the education. So perhaps the policy can go into our education policy as well. And the second thing what we can improve in terms of the policy is that there's quite a lack in terms of policy for mental health at workplace. But some of the government agencies have complemented this. For example, so recently, I think 2 or 3 years ago, they came up with policy to support employees who somehow invalidated with mental health. So they have included mental health in the list of the diseases for the invalidated scheme. Before this, it's all the NCDs such as diabetic, accident, right? So now they have included mental health in one of the lists of the diseases for the invalidated scheme.